Ministry of Health and Wellness. We'll begin this conversation with the update from the Minister.
Thank you very much. Good evening, ladies and gentlemen. Good evening to my colleagues, CMO, Acting PS. Mr. Lynch, our PS, by the way, is off on well-deserved break. And Mr. Lynch, who is head of policy, is acting in that position. Dr. Ennis, who is head of our immunization program, is online. And of course, the usual team in-house. Thank you very much for joining us. So today we are going to discuss a number of issues. Obviously, the ongoing or routine updates on the COVID numbers. And then we will look at the weekend. And we are approaching a holiday weekend, Monday being the Heroes Day and the weekend being the Heroes Day weekend. We intend to continue to offer the opportunity for persons to get vaccinated. You know, we take it for granted that we live in a free society, that we enjoy the democracy, that we enjoy the freedoms and the rights that we benefit from. This weekend is when we reflect, when we give thanks, essentially, for those freedoms, and we recognize those who have fought long and hard to allow us to benefit from what we enjoy as a relatively young democracy. And it is, I think, relevant to link the symbolism, but also the meaning of the weekend and Heroes Day to the challenges that we face now, which is a pandemic that has changed society as we know it, that has placed many of us at risk, that has taken the lives of over 2,000 Jamaicans and many more worldwide, and continues to be a threat. So today I really want to say, let us be our own hero this weekend. And let us be a hero for ourselves, but also for our families, our loved ones, our friends. And let us go out and vaccinate to the extent that we are not. And we have the opportunity to. And so we're going to speak a little about that and some of the activities that are planned for the weekend. And just to continue to encourage you, because we are going to provide the outlets. We will have over 90 outlets available across the country over the course of the 3 days, meaning Saturday, Sunday, and Monday. And so there will be an opportunity near enough to you, and we encourage you to go out and get vaccinated. We have vaccines, the Johnson & Johnson single dose, the AstraZeneca double dose, and I want to just, again, encourage us to take advantage of that. The challenge of COVID-19, of course, remains a major one. In the last 24 hours, some 576 persons were in hospital. Yes, it is coming down, but nevertheless, still high. 393 of that number confirmed positive, 183 suspected. And in the last day, the island recorded some 215 new COVID-19 infections and confirmed 6 deaths, unfortunately. Total number of infections since the first case was discovered stands at now 86,722, while the death toll has moved to an unfortunately high number of 2,059. Even one death is regrettable, of course. Express, of course, our condolences to those who have lost loved ones. At the same time, the numbers reflect some positive signs, but nevertheless sufficient to be still concerned and for us to take the necessary precaution as we seek to overcome COVID-19. So at this point, I'm going to ask the CMO to go into the numbers as we normally do, so you can get a sense of what is happening in the country and our own views from a clinical perspective, public health perspective, as to how we intend to and how we are dealing with that. CMO?
Good evening, Minister, and good evening, everyone. So our update, the data is at the 13th of October. We confirmed 215 new cases yesterday, which would make our numbers now at 86,722 confirmed cases. We now have 2,059 deaths, which is a 2.4% case fatality rate. Our daily positivity rate is 18.1%. We have been below 20%. At 7-day average is 17.4%. Cases are still spread right across the country. We have 2,300 active cases that are right across the parishes. Next slide. And here we can see the distribution across the communities in the various parishes. And we would see that Clarendon, St. Catherine, and Kingston and St. Andrew, as well as St. James, is where we have the majority of our cases. But right across the country, you would see that we have extensive number of communities that are affected, meaning that we're still seeing community spread in all our parishes. In terms of our epi curve, as you're used to seeing, what we can see on the slide now is a picture of the epi curve, and the blue lines show what's happening in terms of the trends. And we can see that the trend is that the numbers are going down. So the number of cases that are confirmed daily are going down. Next slide. And this is right across the country. When we look at the epi curve for each parish, you would see that the numbers are going down right across the parish. In terms of the number of deaths that we are seeing, this is reflected in the red line on this graph, and you can see the number of deaths have been going down. Whenever we've had a peak in the number of cases, a surge, we would see that the number of deaths also increase. And as the number of cases are decreasing, so also are the number of deaths. The number of admissions on a daily basis are also decreasing, and we would see that now we are below 100 in terms of the number of cases that are coming in daily, and it is trending down every day. We had a little scare last week when we saw the numbers going up, but we have seen that they're coming down again, and so the number of new admissions are numbering between 70 to 80 each day. And that also results in the number of beds being occupied overall decreasing. And we can see that we are now below the line, the red line, which represents the number of beds that we had reserved for COVID care. We are now safely below that with just about 500 persons on beds. And this would be both the confirmed and suspected cases. So this is a positive trend, although we are still at a level where we are seeing that the number of cases still have a significant impact on hospital services. We really need to get down to less than 200 cases to be in the green zone, where it is that we won't impact severely the rest of the activities in the hospitals, elective admissions, elective surgeries. Those still have to be put on hold for the most part in order to accommodate the number of cases that we have hospitalized for COVID, because we have to recognize that that takes up a significant number of staff, and especially if they're critically ill, then the ratio of hospital staff to patient increases, and so that it puts a huge demand on the hospitals. In terms of our reproductive number, we can see that that is also trending down, and this is good because it's a reflection of the exposure that is happening in the communities across the country. It means that, or it suggests that there is less exposure. We believe that the restrictions that are still imposed do affect this, and also we would hope that many more persons are taking on personal responsibility in terms of staying home if they're ill, adhering to the infection prevention and control measures, such as wearing their mask, keeping physical distancing, hand sanitizing and hand washing, all of those things will decrease the risk of exposure. And we're seeing this in the reproductive number. So we are hoping that persons will continue these measures. Again, showing that our daily positivity rate is going down. Positive signs. Remember that we want to get below that green line, which is 5%, and we're still at a very high level at 18%. We're just below the 20% line, but where we want to get is below the 5% line. I'm sure everybody would not want to see our cases going up during the Christmas period, and we have to remind persons at this time that just like last year, the increased precautions that we ask persons to take, because coming up to Thanksgiving, that's when persons start to travel, people start coming home from school, persons want to be out and about shopping for the Christmas season, seeing their friends, and there's a huge risk of exposure and increase in the number of cases. So persons have to take the personal responsibility very, very seriously in decreasing exposure, and they have to get vaccinated, because vaccination is one way that is sure that it is going to decrease your likelihood of being hospitalized and having bad outcomes, such as persons dying. So now is the time for the Jamaican population to prepare for the Christmas season by getting vaccinated, and that will help to get our numbers below that green line, below the 5% positivity rate. Next slide. Just to update the population in terms of the return of some of the results that we've had from genetic sequencing. We had 100 samples that were sent to Berlin to be tested, and of those, 95 were sequenced. And what it is showing is that we're having a mixture of the alpha, remember the alpha is the UK variant, and the delta variant among those samples. Very few of the mu variant, which is a variant of interest, not showing that high amount of transmissibility, but the alpha and the delta, it would appear, still remains to be the dominant variants that are in country. We only had one of that batch, only one was the original COVID-19 virus. In terms of vaccination, I'm very pleased to see that the 70 to 79 age group and the 60 to 69 age group, we are seeing just about almost 40% of those age groups having had at least one dose of vaccine. 27.7% in the 70 to 79 age group are fully vaccinated, and a further 11.5% are to get a second dose. And really want to encourage those persons, they are at the highest risk of severe hospitalizations, to get their second dose, and to encourage their neighbors, their church brothers and church sisters to go out and get vaccinated. The 60 to 69 age group, 25.4% are fully vaccinated, and 11.8% have had one dose of vaccine. So very important for these groups to get their second dose. Everybody needs to get the second dose, and what we're seeing is that we have a significant number of persons who would have received the AstraZeneca. 120,000 persons received, just over 120,000 persons received the AstraZeneca in the month of August. And so far, so they would be due their second dose of vaccine now starting in October. And just about 40,000 persons have received their second dose. So we have another 80,000 persons who are due their second doses. Some of these are elderly persons here. They need to ensure that they get their second dose of vaccines. This is the only way that you are going to protect yourself in the upcoming Christmas season, by getting the vaccine now, so that you will prevent yourself from getting severely ill and having to be hospitalized. So the other groups, the numbers are still a bit low, and we need to get them up. We certainly want to get at least 30 to 40% of our population having had at least one dose before Christmas. And so therefore, persons need to go out, get their second dose, and for those persons that have not yet received, please go out and get your first dose. Remember that the Johnson & Johnson vaccine is only one dose, and once you have gotten that one dose, then you are protected. So right across the country, the overall numbers is that it's just under 80% of persons have still not even received one dose. And these persons must come out. 12.3% of the population is now fully vaccinated, and further 8.2% have had one dose, so they're due to get their second dose. We need to move these numbers up. And just again to point out that we have a lot of the Johnson & Johnson vaccine in stock, and several persons are taking it now. And if with just one dose, we can move that needle and put us in a safer place for the Christmas season. Just looking at the hospitalizations again, just to show that in all categories of illness, moderately ill, severely ill, and critically ill, we are seeing a decrease in the number of cases. Next slide. I want to point out in particular what is happening with our children. Many persons have been asking consistently about what's happening with the children, and we did see an increase, a very slight increase we had shown in our last press conference, very slight increase in the number of cases, but now we are seeing a decrease again in the number of cases of children that are hospitalized. However, much more concern is that we're seeing an increase in the number of women who are in the peripartum period, that is, women who are pregnant or who have just delivered, who are being hospitalized with COVID-19. Now, all the COVID-19 vaccines are safe in pregnancy and in the period that you are breastfeeding. And so, therefore, our teams are out in the antenatal clinics to help persons with information so that they can get vaccinated, to have discussions with them. We're asking most of our pregnant mothers see a doctor, whether it is in private care or in the public hospitals, in our health centers. So they have that contact with the healthcare professional, whether it is the doctor, the midwife. They must have that conversation, because here we are seeing very clearly that the number of women who are pregnant the number is increasing for those that are pregnant that have COVID and severe COVID. And so you're more likely to have a severe outcome if you're pregnant, and it can also affect the baby. So therefore, I'm asking you, I'm pleading with you, go and get vaccinated. You have that opportunity because at least once per month, you are seeing a healthcare professional. Please take that opportunity to get vaccinated. Just to look at the persons that are in hospital and to point out again that the vast majority of persons in hospitals are unvaccinated. 99.3% of persons that are moderately, severely ill, and critically ill right now that are in hospital are unvaccinated. And it is only one of the persons that are moderately ill that have been vaccinated. And we have said repeatedly that vaccinations prevent a severe illness and severe outcomes. 40 out of 40 persons that are severely ill are unvaccinated, and 24 out of 24 persons that are critically ill are unvaccinated. You need to prevent hospitalizations. We have been showing the numbers, and it is always upwards of 98% of persons that are in hospital that are unvaccinated. So it is important that you get vaccinated now. So just a summary of our indicators, still a high geographical spread as we are seeing community, still indication of community spread right across the parishes. Still, we have quite a bit of persons on beds, over 500. We want to get that down to below 200. We're still having a high positivity rate, although trending down, but still just under 20%, and we want to get to 5% to be in that green area. Reproductive rate is decreasing, and that is a very positive trend, and this is something that we want to keep down. Remember, how you keep this down is by staying home if you are ill, using all the precautions to prevent exposing others to COVID, and to ensure that you wash your hands, wear your mask, and hand sanitize. And of course, we need everybody to go out because our vaccination level is still low, and we want it to have an impact on transmission. We have to get the numbers up. Thank you, Minister.
Thank you very much, CMO. So I'm going to give you a few updates on vaccines. And again, I say this weekend, Heroes Weekend, we're calling on all Jamaicans to be the hero for yourself, be the hero for your family, your community, and get vaccinated. Now, this may seem a sort of redundant call because we have been calling on Jamaicans for so long to do what needs to be done to protect yourself, to see vaccination as the best and most effective response to the COVID challenge that we face. The Honourable Prime Minister has been speaking. He's out in the field. He was in St. Ann today. I was in Southeast Clarendon, really trying to bolster and re-emphasize and to plead and to argue and to address the concerns of Jamaicans around the vaccination as an important imperative, an important response. We're coming close to Christmas, the holiday season, and it would be a tragedy, to my mind, that we approach this season to not be able to afford the traditions of the season, as we have had not to afford ourselves and our children the opportunity for them to go to school for the last year, or to church in the regular pattern, or indeed to the parties, or to the round robins, or the dance, or whatever else, the family events, the football games. I think the message has gone out. I appreciate the imperfections of the process up to this point. There's no playbook for it. We have to keep pushing. But I cannot imagine that there is a Jamaican today that is not seized with the messaging from the government, from stakeholders, from the different groups, the churches, the trade unions, the private sector, the company or the firm level, around the need for vaccines to be a critical part of getting us back to normal. And, we are entering a period where we have to accept that that message is out there, that we're exhausting this line of policy and approach in terms of moral suasion and trying to get people to respond in their best interests. Yes, a number have responded. We are now 850 plus thousand doses of vaccine administered. We have a 1 million dose target for November, and I believe we can get there. But I do believe that we can do a lot more. And I just want to say that the time has come for us, and I know the government is in deep deliberation, pre-planning, to look at what the next steps are, what are the next options, because we cannot continue in this vein. We cannot continue to have persons putting others at risk because they have not decided to get vaccinated, while those who have been vaccinated, who have taken the time, who have recognized the importance of it to themselves, to their family members, to their work environment, making that effort, making that decision, and they are, in a sense, exposed or have to bear the burden through restrictions or otherwise because of others who have not considered or indeed opted not to pursue the option of protecting themselves and their immediate surroundings. So I really want to urge Jamaicans to listen, but we can't be talking about this forever, because we have to now move the process forward, and we have to now push for a resumption of life as we know it, as we need it, from various perspectives, including our own mental health, including the economics, including the social, and really confront the vaccination program. Now, the vaccine numbers have been low, relatively speaking. If you take the 65% of the population that we had targeted when we started, the numbers are 27% of persons of that 65% number who have had at least a single dose, and 17% who have had double dose. If you take the entire population, then clearly you're low. The CMO gave those numbers. I think it's 12% and 8-odd%, 12% fully vaccinated, double dose, or the single in terms of Johnson & Johnson, just over 8.5% for single. We really ought to be ahead and be making more progress. And it's not because we don't have the vaccines. It's because it's not, and I don't necessarily accept that it's because we don't have the outlets and the opportunities for persons to take the vaccine. Yes, I know persons are waiting on Pfizer, just over 100,000 persons, and I'll address that. But I think, too, that it's really now up to us as a people to go out there and to take advantage of the benefits of vaccines to secure not just ourselves but our communities. So in terms of the vaccines, I want to give an update. The Pfizer vaccine, which I know is a point of discussion and a point of concern, just want to reiterate that you have up to 12 weeks. Several countries, including the US, Canada, the United Kingdom, Denmark, Norway, France, have opted to have much longer periods of second dosage outside of what the WHO has recommended, which of course is the 3 to 4 weeks. Indeed, some of these countries have gone up to 12 weeks. Now, I know that some persons have been waiting 6, maybe a few 7. Well, you have more time. We are making progress. A lot of the deliberations are not just up to us, as we have said, but I believe through the work on the, of the Ministry of Foreign Affairs and Foreign Trade, we will get dosage of the Pfizer vaccine within the period that will allow us to deliver our second dose and persons not to feel as if they have been compromised in terms of the efficacy, having been given this first dose 4, 5, or even 6 weeks ago. We are expected to benefit from at least 400,000 doses from the US gifted, and we have negotiated an additional 201,000 under the COVAX facility for Pfizer, which is what we have purchased. So all told, there's a minimum of 600,000 or so that we will see coming in over a relatively short period of time, over the next few weeks to a month or so. And just to be clear, the decision has been taken that we will give the second jab to the adults and to all who require the second jab, including the youngsters who have gotten it, the first jab. But then after that, we're going to commit all the Pfizer to the young people so that they can benefit from those that vaccine, which has been tried and tested for that population, with the hope of getting our students back in the school system. So I want to urge those who are concerned, who are anxious, who are worried, who are upset, you are still in the safe zone. You are still benefiting from the first dose in terms of the exposure to the virus. We will have Pfizer in time for you to get your second dose. And yes, we regret, we are sorry that you have not gotten it within the 3 weeks that we had originally stated. But again, if we could buy it, we would buy it. We have to wait until we get what is available. And it involves significant complications around negotiations and discussions. But it will come. And I'm very confident that we are closer than we were a day or two ago. The second dose of the AstraZeneca is very important. And you may see on your screen a narrative that we are now going to be pushing both in print and electronic form to really encourage our first doses of AstraZeneca to go out and get your second dose. Well over 100,000 Jamaicans are due, maybe closer to 150, maybe more, a second dose during the next 2 to 3 weeks or so, certainly during the month of October. And we want to urge you, while you benefit from getting a first dose, your full protection comes from the second. So for our AstraZeneca vaccinated first doses, we say to you, double dose, do it right now with AstraZeneca. Head to the nearest vaccine site today or tomorrow, this weekend, and get your second dose. It's important because you are not yet fully protected, even though you are partially protected. And there is enough of you out there, and we are prepared. We have the outlets, we have the vaccines in stock. It is for you to get the vaccines at a location close to you. We have the Johnson & Johnson. And again, the narrative will change, again, as seen on your screen, that we want you to, for those of us who are having second thoughts about the vaccination program, taking the vaccines, fearful of the needle. You know, I was in Southeast Clarendon today, and I saw a man in Hayes literally trembling because he decided to take the jab, the vaccine, but was just scared of it, scared of the needle. And he opted to go with the Johnson & Johnson. And indeed, we have seen the numbers increasing on Johnson & Johnson, which is an encouraging sign. Johnson & Johnson is a household name. They have a good reputation. They have done well in many areas of cosmetics, pharmaceuticals, and I could go on. I'm not their spokesperson, but I believe we need to call it out now and be more direct and frank and identify the brands, because I think it is unfair to those brands like Johnson & Johnson for them to be viewed as an inferior product when they are not. The research, the clinical science, the studies suggest no less efficacy and effectiveness as far as I am concerned, and based on what I've seen. And in the case of this gentleman in his Southeast Clarendon, the Johnson & Johnson was his preferred choice, because guess what? Him getting one jab and it's over. One needle joke and it's over. One jab and it's done. You wouldn't have the problem now that we have with AstraZeneca, having taken the first one and have to go and get the second. So I really want to encourage you, if you have not yet taken the vaccine, if you have any uncertainties, go get the Johnson & Johnson. It's a good product. It works. The history has shown that right across the world. And if you have issues contending with the needle, then that helps, because you go 50% less than if you had to do a double dose. We have a lot of Johnson & Johnson, and we have a lot to get. And one of the reasons we did that was because we figured that a lot of Jamaicans don't like the needle, particularly the men. Well, it's not going to impact you in any way, shape, or form, except to give you the protection that you need. So we say, be a hero this weekend or any other weekend after this, and go get the single jab Johnson & Johnson, because we have it in stock and we want to encourage take-up. So we have had about 35,000 Jamaicans already taking the Johnson & Johnson vaccine, and the response, the testimonials is that it has worked. You know, the vaccines provide us an opportunity to get back to normal, gives us an opportunity to get back to doing the things that we are accustomed to. While we can engage in non-clinical measures, the shutdowns, the restrictions, the truth is it has impacted us. That impacted our mental state. It has stopped us from going to the church, the choir meetings, the round robins, all the other stuff. And very importantly, our children from going to school. And we really want to pass this phase and get back to normality. Up to 4 p.m. today, the ministry had administered some 859,281 doses of the COVID-19 vaccine, or a vaccine. Number includes some 521,097 first dose, 294,261 second dose, and 36,923 single dose of the Johnson & Johnson. And so we are edging forward, making progress, well over 800,000. And this is encouraging. As I said earlier, so far, based on the 2/3 targeted population, the 65%, we're at 27% of the 1.9 million having had partial vaccination and 17% fully vaccinated. And our target of 1 million doses, as outlined by the Prime Minister, between now and the end of November, we're hoping that we can meet that target and surpass it before the end of November. So we are working hard, and this weekend we would like to see persons going out. Now, as it relates to this weekend, Heroes Weekend, we are embarking on a program to ensure that we provide the opportunity through the expansion of outlets across the country to allow you to take a vaccine, single shot or double dose, whichever, second dose or first dose. And so on this Heroes Weekend, we're asking you to be your hero, be the hero on the scene, take the COVID-19 vaccine. We have some 90 vaccination sites between Saturday, October 16th, and Heroes Day, Monday, October 18th. And those 90 sites across the country, we will begin to blast those out. It will be on the website of the ministry. We'll push those out through mainstream media, electronic media, social media, or alternative media. And the intention is to provide a site almost in every critical location or population center. And accompanying those sites are the town criers to give the community adequate notice and information that you can go out and get your vaccines. Those sites are going to have both vaccines, Johnson & Johnson and AstraZeneca, because of course we're yet to get the Pfizer, and you have the choice of getting first or second dose or your fully single dose at those locations. In addition to that, this weekend we will see a number of our private contractors who have been vetted and contracted to offer vaccines open to administer vaccines at no cost to you. So if you're in Kingston, you don't want to go to the arena, you can go to Windsor Wellness Center on Monday, which is a holiday. You can go between 9 a.m. and 5 p.m. If you're intimidated by the crowds at the arena, even though in the afternoon we tend not to have crowds anymore, go to that private facility, Windsor Wellness Center. You can go to Winchester Surgical in Kingston, 10 a.m. to 3 p.m. on Sunday. You can, if you're in Montego Bay, go to Bay West Wellness, Monday 9 a.m. to 5 p.m. That's on the holidays. You don't have to go to a public facility. And there are others that will be open. We will provide the information by putting those out on the website. So we're giving options to Jamaicans, to the public, to not just get the vaccines, including the single dose Johnson & Johnson, but multiple locations, private and public, so that you take the opportunity to benefit from getting vaccination, because that is the focus now. Restore normality, being your own hero, protecting yourself, and this weekend will be a big weekend for that. I want to say too that we have selected 11 private entities that are now able to administer vaccines at no cost to you. 8 are in the final, additionally, are in the final stages of the preparation process. So we're hoping to go up to about 19 or 20. These are private hospitals like Medical Associates. These are private doctors' establishments, pharmacies. And so to those Jamaicans who may not want to go to one of the public entities, you can go to a private entity. And indeed, if you're a company and you want to invite a provider of vaccines to administer to your employees, you have that opportunity to provide vaccines to your employees. In addition to that, this weekend, would be eligible to win cash and prizes up to 250,000 Jamaican dollars. And you would have to be vaccinated between Saturday and Monday. There are also a number of private entities that have provided gift vouchers, Rainforest, Hilo, JPS, Digicel, gift vouchers based on the products that they have. And we have also vouchers that are in cash, eligible to win up to 75,000, 50,000, 25,000, book vouchers for from Kingston Bookshop up to 20,000. And the basic principle is that when you go to get vaccinated, you indicate whether or not you're interested, because clearly it will be based on your willingness to participate. Not everybody may want to participate. And your name will be identified as an interest, and you'll be uploaded. And come after Monday, we will determine, or they will determine, under the protocols and regulations that they operate, those lucky persons who would benefit or would have won a prize for getting vaccinated. The idea here is to encourage, to motivate, to incentivize, to get persons to move with alacrity, with pace, with speed, to get vaccinated, whether second dose or first dose. It may not work for everyone, but we're trying all the possible options, and it is not unique to Jamaica. It has happened in other countries. We have online, I am told, the Deputy CEO and Chief Marketing Officer of Supreme Ventures. Is that so? She's online. Heather Golson. And I'm just going to give her a couple of minutes just to speak to that Vaccine Win program that the Supreme Ventures has put out some time ago. It's not new, and what it involves. Hi, Heather, how are you?
Well, thank you, Minister.
Okay, great. Tell us a little about the program.
Just to jump into the program, we started this back in June of this year, and we recognized that it was absolutely critical for us to do our part to make sure that our Vax heroes are rewarded. So for this weekend, we are so happy to be able to partner with the ministry to amp this program up and to encourage even more Jamaicans to come out and get vaxxed. So as you said, the top prize is 250,000, second prize is 100,000, and we're giving away an additional over 400 prizes, as you alluded to, from various companies. So we're very excited about this. We encourage all Jamaicans to do their part, become a Vax hero, and join Vaccine Win.
Okay, great. So the idea, of course, as I said, is that not everyone may want to participate, and health information is highly confidential information. There's no information that will be divulged as it relates to one's health status. It really is when you are being vaccinated, you indicate if you're interested, and our database would just apply your name. That's all. And then, of course, depending on the process, which I know you're guided by the betting, gaming, and lotteries commission. I think that's what they're called, right?
Those are our regulators. In this case, we're running.
Right.
In this case, we're running trade giveaways, so we're very safe, and we want to assure everybody that everything will be very well handled.
So I just want to make that very clear, because I don't want any misunderstanding as it relates to what is happening. But it's a good partnership. I think that there are many Jamaicans who, it's an important task to get vaccinated to protect yourself. It's not that you're being, encouraged by giving away something. But if you can get something in the process, why not? I mean, and if this program works, I think people can benefit.
Absolutely, we think of it as a reward more than anything else. I mean, you're doing your part to protect your community. You're doing your part to get the Jamaican economy restarted. You're doing your part, and it's important to be rewarded. So that's the way we like to think about it. We're rewarding our Vax heroes.
All right. Well, I'm sure you're going to put out some further info over the next day or so, leading into the weekend.
We will.
And we partner with
Absolutely.
you on that. And thanks a lot for everything. And let's continue to partner, because it's important.
Absolutely. Thank you so much.
All the best. I saw we're Sagicor, and I'm naming names. Not here advertising anybody's business, but I'm naming names. I saw we're Sagicor. That's the Chris Zucker-led organization, has announced for everyone who has been vaccinated. I think there is some account that is established with a minimum amount for is it a child? I think it's a child. I'm seeing a lot of positive incentives at the firm level for persons to get vaccinated. I'm seeing also a lot of incentives that may be punitive for persons who don't get vaccinated. Companies have said it's now mandatory, for example. I see Digicel, I see CariMed, I see NCB, and I know smaller companies have been doing it. They may not have been advertising it. For me and for us, all it says is that there is a recognition, and government is very seized with that it is the way out to get back to normalcy. It is the way out to get back to work, to get back to our social setting, to get back to our church, to get back to our regular lives as we know it. And so many of us could not be wrong in terms of the value of vaccination, that it is good for us, it is good for our environment, it is good for life as we know it. And frankly speaking, I believe those who choose not to, over time, are going to be left out, are going to be isolated. And I know that the government is considering carefully, while still recognizing the importance of freedom of choice and the fundamental rights of each citizen. How do we recognize the responsible action and the greater good of our society for those who take the decision to protect themselves? Indeed, every other country is doing so. In a few months, you may not be able to travel to the United States, to Canada, to other places, unless you have a vaccination proof. The farm workers, the visitors, the business people. The world is coming to terms with the importance of this. And so I say to Jamaicans, this is worth serious consideration. And we will do all our part. And I don't accept, at the risk of being criticized as the Minister of Health, I do not accept that persons are not getting vaccinated because they don't know, because they don't have a location. Yes, it may cost a taxi fare or a bus fare because it may not be right in your backyard. But, you know, we do many things where we make effort, and this is life and death. So some effort is always going to be required. I do not accept at this point in time that it is because we don't know, that we have not been told, that the messaging, even if it is off at times, has not sought to address a number of the issues, and that the vaccines are no longer available, are not available, because they are. Maybe not one brand, but others are. So it really now boils down to saying to each of us, we have a personal responsibility. And if we don't, then we run a risk, as I said before, of being left out. I really hope that good sense will prevail and Jamaicans will recognize the importance of this. So let's make this weekend a good weekend for the vaccination program. Let's put, 30, 40, 50,000 people getting vaccinated. And then the week after, let's continue to build that momentum, get to that 1 million mark. And I believe in November, it will only get better when we would have had Pfizer. I believe we will. And we would have been seeing the value of taking the single jab in J&J and, of course, continuing on the AstraZeneca. All right, so thank you very much for that. And I'm now going to ask Stephen to go through the questions. Thank you.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom to pose their questions. We're going to begin with Christopher Thomas from the Gleaner.
Yes, good evening, Dr. Tufton, and to the members of your team. I want to put this question to Dr. Bisasor McKenzie as it relates to the number of vaccinations to date. I want to focus specifically. Do you have the number of nurses or other medical professionals who would have been vaccinated up to date? And if you have those numbers, do you have them by region?
Unfortunately, the collection of the data on healthcare workers was not narrowed down into the different categories. So what we have is a broad category of healthcare workers that I believe we can furnish the data by region, but you would not be able to see how many doctors versus how many nurses versus other persons.
All right, thanks, Amo. I'm going to go to Cassius Watson from Jamaica Social.
Hey, good evening, folks. Can you hear me?
Yes, go ahead, please.
Okay. Just one question, really, and this goes to the minister. What is or what stage are you at now? As you had introduced to us, I believe a week or so ago, you mentioned vaccination passports. What's the status of that? How far are you into a full execution or rollout of those passports?
Right. So we're going to cabinet on Tuesday. Monday is a holiday, with a proposal for consideration. So a lot of work has been done over the last few weeks, looking at the options that are available, looking at potential providers, looking at the approach, looking at the requirements, the criteria, looking at the best practices or the international standards. And a document has been produced. And this, of course, is in conjunction with the public health team and the private sector vaccine initiative group, led in this instance by Mr. Peter Meledo. Dr. Ennis is very prominent there, our head of our immunization program. So Cabinet is going to be looking at the work that has been done, and will consider and hopefully agree on an approach, at which point we will pursue in earnest and with focus that particular approach. So there'll be some options, and then we'll ask Cabinet to decide on those options. So we've made some progress.
Thank you very much. We're going to go to Emma Lewis.
Yes, good evening, everyone. A couple of quick questions. the CMO, you mentioned that the R rate is looking better now, but I didn't make a note of, that is the reproductive rate. I didn't make a note of what it is now. Are we in the kind of safe zone for that?
I can't say that we're in a safe zone, because it's what happens with the reproductive rate. What is the end product of the reproductive rate being low? If you have high numbers of persons that are positive, then it's going to take the reproductive rate being low for a little bit of time in order to get those numbers down. So we can't be safe even if we're at, it looks like maybe about 0.8, 0.9 now. Even though we're below 1, we can't be safe. What we have to do is we have to try to keep getting it lower, but we have to maintain it. And it is the maintenance of that reproductive rate below 1 that will keep the numbers going down.
Thank you very much, CMO. We're going to go to Zara Burton from 18 Degrees North.
Good night, everybody. Excuse me. Hold on. I did not realize that the camera was on. Sorry about that. Okay, so my question is for the CMO. I wanted to know what is your position on vaccine mandates and mandatory vaccination from a medical standpoint?
I think that our overall aim is to get our vaccination numbers up. And I think that as an overall goal, in order to protect our population, is what is key. I think that measures have to be put in place in order to get those numbers up. However, the decision in terms of a mandate is a decision that will be taken by the cabinet of the country. If you look at the WHO's position on it, there are several things that have to be considered in terms of the vaccines, the availability of the vaccines, the efficacy of the vaccines, the risk that persons within the country are at. And we would have carefully, and we are carefully considering all of these items. But the bottom line is that in order to protect the population and for us to be able to get back to as near normal as we can, we need to get our numbers up.
All right, thank you very much, CMO. Minister, those are the hands that we are seeing, so I'll hand over back to you for your closing remarks.
Okay, great. So it seems as if we have an early evening today. A lot has been said. A lot will be said in the weeks to come. Reviews taking place, looking at the process, looking at how we proceed going into the next few months on a number of issues. And we will certainly keep the public informed. But I think, generally speaking, there is a determination to continue to move in a direction of restoring normality. And we do appreciate that the population, or important segments of the population, the church, the business community, have been saying, encouraging greater take-up. And that for us is encouraging, is good, it's important. This weekend, we want to ensure that we are all heroes for ourselves and our families, and go out or encourage others to go out and be that hero and get vaccinated. And the narrative will be heavy on that. The focus, even on the no movement day on Sunday, you can move to a vaccination site. Not an issue at all. Let us go out there. And the best vaccine is the one that is available. So don't discriminate only if you want to go a single as opposed to a double. So we look forward to that. We look forward to the weekend, the numbers going up, and we encourage all of Jamaica to participate, and let's work towards restoring our country as we know it, as we love it, and as we would like it to be. I want to take the opportunity to close by thanking the healthcare workers across the country. They have done and continue to do an amazing job. They are heroes already and should be recognized as such, certainly in general terms, but as it relates to this COVID response. And I want to encourage all of Jamaica, when we see them, when we encounter them, when we have to deal with them, give them a little nudge and a little encouragement. Because the truth is, without them, we would be a lot worse off. So I want to just say big up to them, big up to our healthcare staff, our frontline workers, and to all those who are contributing to overcoming this threat as we know it. Thank you very much. Have a good evening and enjoy your weekend. And remember, be your own hero. Get vaccinated. Help someone to get vaccinated for their sake, for yours, for your loved ones, for your family, and for your country. Thank you. God bless.
COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth at all times. Masks should never be worn over the head, under your chin, below your nose, or hanging from your ears. Recovery from COVID-19 can take up to 60 days or more. The mask or the ventilator? You choose. A message from the Ministry of Health and Wellness.